Hello everyone. Majority of us will suffer from COVID in this current wave, but most will be asymptomatic or with mild symptoms. Many will self-medicate on basis of advice from friends, unqualified pharmacists, or information available online, which is potentially an unsafe practice. In this video, I'll explain how to safely self-medicate for mild COVID symptoms at home. In this video, you will know about blood tests done in COVID and medication for COVID.
Who should take this? If you have fever greater than 99.5 or body pains or headache even without fever. How does it act? Paracetamol blocks pain signaling chemicals in the brain. It decreases fever by altering chemical messengers in the brain's temperature regulating region. For how many days, till symptoms subside? You can stop once you don't have fever or pain. Who should take this? If you have running nose, sneezing, stuffy nose, watery or itchy eyes and throat irritation. How it acts? It's an antihistamine. The drug blocks histamine, which your body makes during allergic reactions and infections. For how many days, till symptoms subside? Usually, 5 to 7 days. Who should take this? If you have dry cough. It can also be taken for productive cough for symptomatic relief. How it acts? It suppresses your cough by temporarily blocking cough center in your brain. For how many days, till symptoms subside? Usually, 5 to 7 days. For how many days? For 10 days. How it acts? Vitamin C acts as an antioxidant, helping to protect cells from the damage caused by free radicals. Rationale for use: there is no strong evidence to support using vitamin C for COVID. But vitamin C has shortened infections caused by other respiratory viruses. National Institute of Health recommends against using zinc supplementation for COVID. Long-term zinc use can cause copper deficiency, resulting in blood defects like anemia and irreversible neurologic defects like myelopathy, disease of spinal cord, paresthesia, tingling or pricking sensation, and spasticity, abnormal muscle tightness. In addition, oral zinc can decrease the absorption of some medications. National Institute of Health recommends against the use of antibacterial therapy, for example, azithromycin, doxycycline, for the outpatient treatment of COVID-19 in the absence of another indication. Antibiotic misuse causes antibiotic resistance. Laboratory tests recommended for the initial diagnosis and monitoring of disease. Complete blood picture, CBP, provides important information about the kinds and numbers of cells in the blood, red blood cells, white blood cells and platelets. Abnormalities in these can indicate the presence of diseases. How does it help in COVID? Used to assess coexisting diseases like dengue, when the platelet count decreases, or bacterial infections, when the white cell count is very high. C-reactive protein, CRP, made by the liver is released into the blood in response to tissue injury, such as infection or inflammation. Increased concentrations can be found after a heart attack, in sepsis, and after a surgical procedure. How does it help in COVID? CRP isn't COVID specific, but it shows the body's infection or inflammation level. D-dimer is a breakdown product of the blood clotting protein fibrin. D-dimer levels rise when blood clots form in deep veins inside the legs or when fragments of the clot enter the lungs, causing chest pain and breathlessness. D-dimer levels are also elevated in recent surgery, trauma, infection, liver disease, kidney disease, cancer, pregnancy. How can it help with COVID? Increased levels of D-dimer indicates clotting and inflammation. Ferritin is a protein complex that stores iron within cells. Acute phase reactants, such as ferritin, may be elevated in patients with inflammation, liver disease, chronic infection, autoimmune disorders, and malignancy. How can it help with COVID? Elevated levels of ferritin in COVID patients indicates inflammation. Troponin I is a protein in heart muscle. Damage to the heart releases troponin into the blood. Troponin levels rise when there is a heart attack or other heart damage. Values that are elevated but unchanging may be seen in chronic heart failure, hypertension, severe infections, and kidney disease. How can it help with COVID? Elevated troponin levels help detect heart damage. Interleukin-6, IL-6, is an essential inflammatory cytokine. In response to infection or inflammation, IL-6 stimulates liver cells to produce acute phase reactants and antibody-producing B cells to proliferate, resulting in an improved antibody response. These responses help the body fight infection and inflammation. The test is routinely used to evaluate systemic inflammation associated with infections, autoimmunity and cancer. How can it help with COVID? IL-6 isn't COVID-specific, but it shows the body's level of inflammation. Kidney and liver function tests. These are a set of blood tests which help in assessing functioning of kidney and liver. How can it help with COVID? COVID patients, especially those with severe diseases, suffer liver and kidney damage. This advice is for individuals over 18 years old who are not pregnant, breastfeeding and are experiencing mild symptoms of COVID. Visit your doctor immediately if you have following symptoms: trouble breathing, persistent pain or pressure in the chest, new onset confusion, inability to wake or stay awake, pale, gray, or blue-colored skin, lips, or nail beds, depending on skin tone. Oxygen levels in pulse oximeter is less than 94%. Any other symptoms that are severe or concerning to you.
Thank you for watching my videos. Please subscribe to my channel and click the bell button.